In this video, we will review a common tool for understanding public versus expert assessment of risk. The health risk equals hazard plus outrage formula will be applied to the issue of COVID-19 vaccines. We will cover how to define health risk, hazard, and outrage as related to the COVID-19 vaccine, learn how hazard and outrage affect subject matter experts, or SMEs, and the general public's, non-experts' response to health risk. And lastly, learn what an appropriate risk communication response should be for different levels of hazard and outrage. So, what is the health risk of either getting or not getting a COVID-19 vaccine? To answer this question, there are two key components to consider: hazard and outrage. Subject matter experts, also known as SMEs, such as physicians, scientists, or public health officials, consider risk in terms of hazard. Hazard refers to two things: the actual danger posed by a health threat and the possibility that it could cause harm. For example, an SME might say developing blood clots after getting a COVID-19 vaccine is extremely rare. They would say this because the number of cases is quite small when compared to the very large number of vaccines that have been given. Research shows that the general public who face a health risk perceive risk differently than SMEs. When the general public thinks of health risks, perception and emotion often overrides reality and facts. This is where outrage comes in. Outrage is the term traditionally used by risk communication experts when talking about the emotions people feel toward a risk. The general public's perception of a health risk is a sum of hazard, the actual threat, plus outrage. In other words, audience perceptions often matter more than reality when it comes to beliefs about a health threat. For instance, some people get very worried or even upset about health threats that are very unlikely to cause them significant harm, while other people are not concerned at all about health threats that are likely to affect them. Back to our example on the risk of developing a blood clot from the COVID-19 vaccine. Public health officials, the SMEs, can say that the health risk of getting blood clots is incredibly low. They can even add that the risk is 5 times lower than the risk of being hit by lightning. However, some people will still be concerned about the potential negative effect of blood clots, even if those blood clots are rare and may feel angry they are being told to have the vaccine. This is an example of outrage and how it affects perceptions of health risks. In our example, the vaccine side effects news may convince some people who were undecided not to get vaccinated after all. It may also strengthen the beliefs of those who were already against the idea of getting vaccinated. This increases the hazard of the unvaccinated for getting COVID-19. This means that their health risk of getting COVID-19 and having severe symptoms is much higher than if they were vaccinated. To sum up, the health risk equals hazard plus outrage equation is extremely important to understand to create the optimal risk communication response. So, what is the best risk communication strategy for different levels of hazard and outrage? As this diagram shows, there are 4 different scenarios, each with a different purpose or goal. Number 1, low hazard and low outrage. That means that the general public's perception of the threat matches the actual risk. For example, consider the likelihood of mild side effects to a COVID vaccine, such as swelling and redness at the injection site. This falls in the low hazard / low outrage category because the side effects are not serious and very few people are likely to be worried about it. Therefore, there is little need to communicate about it. Number 2, high hazard and low outrage. This is when the general public face a big health risk and are unaware or unconcerned. In this situation, risk communication efforts need to focus on the threat among those most at risk. The goal here is to convince people to take preventative actions. An example would be the COVID-19 vaccination issue. Some people do not get vaccinated because they think COVID-19 is not very harmful. Risk communication efforts need to persuade them to take the recommended precaution, in this case, a COVID-19 vaccine. Number 3, low hazard and high outrage. In this case, communicators should engage in outrage management. Think back to our earlier example of the perception that COVID-19 vaccine has side effects. In this case, you need to identify and address concerns that the vaccine is harmful or risky. The goal is to reduce or even eliminate outrage or concern by changing perceptions regarding the actual risk and explaining the low hazard. Number 4, high hazard and high outrage. This is the most serious of the 4 scenarios. And this is where you must engage in crisis communication. Here, the general public are at risk of harm and they know it. As a result, there is high concern and much interest in information about the risk. The goal is to help the general public to effectively cope, respond, and reduce their risk. You must provide information quickly, and that information must be useful to reduce or prevent harm. This type of communication occurred as COVID-19 began to spread and audiences' fears about the virus grew. In this video, you learned how to define health risk, hazard, and outrage related to the COVID-19 vaccine. You saw how hazard and outrage affects SMEs and the general public's response to health risk. And lastly, you learned what an appropriate risk communication response should be. To learn more, please continue to tune into our Communicating About COVID-19 Vaccine Safety video series.